Hello, friend, and welcome back. Today we are talking about Sculptra Aesthetic by Galderma. So Sculptra is an injectable biostimulator, which means it's stimulating your body to make collagen, it's stimulating your body to do something. I liken it to injectable retinol, but it's just making collagen, and it's going to be in there for a while, and it's going to just gently nudge your fibroblasts to make more collagen and make better collagen, as well as some of the stuff that helps support collagen synthesis. It's going to stimulate all of that so that your skin looks smoother, more youthful, more volumized. Thank you to the viewer who asked for this video. I thought I had already done it, but apparently not. Just played it through too many times in my head. So I try to provide the best information I have access to you in the most easily accessible way. And that's what we're going to do today with Sculptra, which is one of my favorite products for in-office procedures. Sculptra is poly-L-lactic acid. It's a powdered particulate that comes in a vial, and then we reconstitute it or dilute it with some fluid and lidocaine. Lidocaine is a numbing agent to make it a little bit more comfortable. Traditionally, we would treat one vial per side of the face, usually 2 vials per treatment. I mean, that can vary widely, and we'll talk about that. Part of how poly-L-lactic acid, or PLLA, Sculptra works is through a mild inflammatory process. So it's triggering some inflammation so that your body starts to respond and builds collagen. And that is the end game for any Sculptra treatment, is we want to stimulate the growth of collagen, specifically collagen 1. Now, there are a bunch of different kinds of collagen. Some of them are prettier than others. Some are in our skin, some are in our tissues. But typically, when we are trying to stimulate pretty youthful looking collagen, it's going to be collagen 1. Sculptra also stimulates a little bit of collagen 3, which is less desirable, but it can mature into collagen 1. So Sculptra shows an increase in collagen synthesis by 66% at the 3-month mark. So after your first injection, you're making 66% more collagen than you would have been otherwise. That's one of the reasons why I love Sculptra so much, especially in this undetectable aesthetic area that we're entering. I'm getting more and more requests for something natural. I want to look natural. I want to look like myself, but I really don't like this fold, or I really don't like this line, but I don't want to look puffy faced. I get more and more patients who are concerned about hyaluronic acid based fillers, which is traditional fillers. I understand wanting to stimulate your skin to look better on its own versus the idea of something artificial in there. The old way of preparing Sculptra was very thick. In the last 3 to 5 years, they have changed that protocol, so we use more fluid to dilute it, so it's a thinner fluid, which I think makes it hugely easier to work with, a much better patient experience, and much fewer weird outcomes. It's a lot more predictable. When you have that thinner fluid, it's easier to diffuse and integrate into the tissue. Usually I have 2 or 3 entry points on each side of the face to inject this, so that's very few needle pokes for this kind of thing. And then we use either a long sharp needle or a long cannula, which is a soft tip needle, and just fan it around the face into the areas that we're targeting. Now, for nasolabial folds, we might go in with a little more targeted approach, but generally a couple of pokes on each side of the face, and then we do a vigorous massage to make sure it's really spread throughout the tissue nice and evenly. Aftercare is typically limited to the 5-5-5 rule. You're going to try to massage 5 minutes a day, 5 times a day for 5 days following your initial injection. And that's really just to work this product into the skin, make sure that circulation is passing over each of these little stimulating molecules as much as possible so that everything is getting the message, hey, we are making some good collagen 1. I need everybody to be working on it. And so the more you're massaging that, the more that it's just keeping it kind of active in that initial placement and making sure it's really spread throughout the tissue nice and evenly so you get a nice, even, predictable result. That was trickier back in the day when it was very thick and syrupy because you just have this kind of glob in there, and you really need to make sure that you're massaging it to the areas you want. Otherwise, you could wind up with this hyperdensity collagen area. If that occurs, you certainly go back to your provider and talk it through with them, but there are ways to break it up. I've heard of deep microneedling being really effective to just kind of break up that hyperdense collagen so that it can kind of smooth out and lay how it's supposed to, as opposed to in one little knot, if you will. There are also techniques with saline or salt water that you can inject and then vigorously massage it and break it up that way. But the point is, this is different from a true nodule, which is a pathology. Nodules can occur with a lot of things, just about anything that winds up as a foreign body in the skin, but also bacterial things. It's just your body has tried to break up this foreign invader and has been unsuccessful. So there's this nasty little particle that your body has decided it doesn't like. And so your body just makes this little capsule around it, and it's just to wall it off so that your cells aren't exposed to this weird invader anymore. But you do wind up with this encapsulated little lump there. Those need to be dealt with by a trained professional who deals with them frequently, but those are different from the kind of unevenness or lumps that we used to see with Sculptra, because with Sculptra, it's truly collagen that's kind of knotted together, and the other is a true pathology that needs to be removed and or dealt with in a sometimes surgical way, sometimes it's antibiotics, but it's rarely a pretty thing to deal with, and you don't want to go down that road thinking that Sculptra has caused this unless your provider is absolutely certain. So that's one of the horror stories you can find on the internet, but it's really rare now because that thinner dilution allows the skin and the tissue to really just take it in more evenly as opposed to it collecting in weird areas. Now, part of how Sculptra works is an inflammatory response. So it's calling your immune system to do some things for us. And part of that is to break this molecule down so that it's usable and helps stimulate your fibroblasts to make more collagen 1. So we need that inflammatory response. Even though we've thought of Sculptra as having a primarily inflammatory component to its action, in the studies that they've done, it's a little bit less angry inflammatory response than we thought. It actually helps kind of modulate some inflammatory markers. Even at 3 months out from that initial injection, that inflammatory marker is actually being modulated. So we're actually seeing anti-inflammatory effect and nicely regulated skin functioning at that 3-month mark. So it doesn't rely on that inflammatory response to keep it working. It just sort of kicks off with that inflammatory response. And we know that even at 6 months, you still have 50% of that product that is well and happily working along. It hasn't been broken down yet. So yes, we get these nice long effects. Thankfully, it does not fully rely on inflammation, and I feel like that's something that we kind of should have assumed earlier on because it was originally used for HIV patients who are the most immunocompromised population out there, at least at that time. And still, they were having these amazing responses of revolumizing these areas. And if their immune system was less than great, to say the least, and they were still able to have these responses, we should have known that there was a different process that was ultimately responsible for making collagen. But it is just nice to see the published literature saying, no, this isn't 100% inflammatory response. That's kind of the kickoff point, but your skin gets back to a nice homeostasis and gets re-regulated pretty rapidly. We still see about 50% of the product still there at 6 months. So while it's being broken down, while it's being used, we get this nice long effect of just continuous collagen stimulation. So you do need to be patient. It takes that kind of 3 to 6 months before you see a really nice noticeable improvement, and you need to be realistic about expectations. Because there's some inflammatory response to this, your body has a limit to how much it can respond in any one time, which is why I personally tend to avoid really huge amounts of this at one given sitting in one treatment. I tend to stick to the 2 vials per treatment. And if we need bigger changes, I would see that patient back more frequently throughout the year. Usually we do a series of a couple to several of these. My personal choice is 2 to 4 months in between each treatment to give your body a chance to kind of reset and be ready to respond again to a new influx of stimulation, because as we know, like we put this in and we got the stimulation effect and it kind of peters down over the years, but then we're going to put in a little bit more. So we'll have a bigger effect and that'll peter down. So as we stack these treatments over time, we get that nice big effect that we want in the end. But I think, especially in my more mature patients, I just don't think the body can mount a decent response if we're putting in 4, 5, 6 vials in one sitting and hoping for the same effect as if we did 3 sessions of 2 apiece spread out a couple months apart. I think it's more respectful of the body's processes, and there's some literature to support that. There's also some literature to support that if you do big doses in one sitting that you can have a good response. I just think that's more in kind of the body shaping category, which is becoming very big. There are some practitioners doing like BBLs, like Brazilian butt lift effect from 10, 20, 30, 40 vials of Sculptra and similar products into just tastefully injected into the glute and building that tissue to either lift it, to replace deficits. If there's, hip dip, that kind of thing, you can replace those deficits with this type of product. And I think it's very cool. There are a lot of cool options with it. But in my practice, the kind of top three areas are the top three areas of most aesthetic practices of face, neck, and décolleté. Those respond really well to it, especially décolleté. This is an area that you get a lot of sun exposure here. And if you're out and about a whole lot, if you're hiking, sunbathing, whatever, please don't sunbathe. But if you're out and about in the world, this area gets a lot of exposure to the elements and to UV radiation, which is going to break down your collagen. And that leaves us with that crepiness, that texture, those lines, and they're very hard to get rid of. It's rare that anyone would put true like HA filler in there. A lot of microneedling and laser treatments can focus on that and slowly build collagen. But I think Sculptra is a slam dunk down here because we can hyper dilute it, just make it a little more watery and really cover this whole area and get that nice firmness to the skin, take care of that crepiness and texture. It doesn't do anything for pigmentation, so that'll be lasers and topicals, but it can have a marked difference in a really hard to treat area. Same thing for the neck. It's a sensitive area. It's a thin-skinned area. There's not a lot of room for injectable fillers like HA, but you can rebuild the collagen fibers to this nice tight-knit matrix of collagen, and you will see some lifting. You will see some tightening around this area. I definitely feel like I need to treat neck and décolleté more treatments and with more vials than I do for face, generally because my patients take really, really good care of their face and often their neck, but décolleté certainly gets overlooked more frequently. So I think this is just more primed to respond to Sculptra versus down here, where we have no fat pads, very few oil glands, and follicles, and just a lot less structure down here. So it takes more treatments to see these nice results. But when you hit that nice result, it's beautiful. It's wonderful, wonderful treatment. And that's one of the many reasons I love Sculptra. Speaking of off-label areas, one of the creative uses that I've seen come up a time or two is topical applications. So mixing up the vial of Sculptra and then microneedling it into the skin, or using resurfacing lasers to make microchannels to the skin, and then same thing, applying it topically and assuming that it's going to work the same. Now, that doesn't seem to work. From the studies that I've read, there just isn't enough penetration assistance for that to work. It doesn't get to the right plane of skin to stimulate fibroblasts in the right way. Microneedling is fairly superficial. But truly, to apply it topically and have it work the right way, you need a fully ablative laser that's usually done by a physician, board-certified dermatologist, or plastic surgeon. An ablative laser is truly destroying that tissue entirely. These are the big, scary lasers that have a lot of downtime in general, and it's only when you've truly destroyed that tissue in the microchannel that it stays open long enough and is a large enough microchannel for polyl-lactic acid to really get into the dermis and trigger the results that it needs to. Otherwise, it seems like it's kind of a waste of money, any of the microneedling and topical applications. So for the moment, until we have better studies out there, just get it injected by a professional. When we talk about body work, it doesn't have to be so dramatic. Another nice place is backs of hands. We tend to see a lot of volume loss to our hands for a multitude of reasons, but we're not great about sunscreen, and these get a lot of sun exposure when we're driving, at least in the US, where we're obsessed with our cars. So volume degradation and collagen degradation is pretty common in the backs of hands. And again, not a whole lot of things to do to treat that. I will do some HA filler. There are a couple specific kinds that work really well in the hands and actually have indications in the hands, like Restylane Lift. But Sculptra is another nice natural approach to that of, if we do a vial per hand, you're going to have marked improvement in the volume. So less of the veins showing through, less of that hollow kind of skeletal look in the hands. And then also the backs of arms. This area is tricky to treat without surgery, but doing really tasteful several sessions of Sculptra here, you can see a marked improvement in the tightness and firmness of that appearance, and it really does great at getting rid of the crepey texture. All right. How much for the amazing miracle potion? One session of 2 vials in my area between $1,200 and $2,000. So you're in it for about $4,000 on the high end. That said, there are a lot of things you can do to make sure you get the most out of each treatment. I've recommended this product a whole lot on this channel, Alastin Restorative Skin Complex. or regenerating skin nectar, either or, does a really good job at priming your skin to respond to collagen stimulation. There's an adage that good old Morgan has pounded into my brain of out with the old and in with the new. It does your spring cleaning. It clears out by helping your body's natural breakdown processes. It helps clear out old collagen so that you have all of the space and just a clean bed for that new strong collagen to grow. When you have all of these broken down nasty little bits of collagen and stuck together bits of collagen from like glycation structures and stuff, it can be confusing for your body to focus on which collagen is worth saving versus starting new collagen. It just makes for a less optimal environment for you to grow new collagen. So I recommend all of my patients who are doing anything collagen stimulating like microneedling, laser, or Sculptra especially, start by at least 2 weeks of twice-a-day use of one of those two Alastin products. They are the most concentrated. They do the most clear out, especially if you're naive to any of these kinds of treatments. This is your first time in. I want you to at least do that for a month ahead of time so that we have set the stage. We have primed your skin to respond beautifully to this stimulation, and then follow up, same thing, for about a month afterwards. It would be ideal if you could stay on it year-round, but I do understand budgets. So the bare minimum for a really good response in my practice is use that Alastin spring cleaning product for a month or at least 2 weeks ahead of time and then a month afterwards. And that just helps you get this really nice, quick result and effective result. So you're making the most of this kind of investment. I also recommend oral collagen peptide supplements. The science on this one is a little bit fuzzy. Theoretically, it shouldn't be any different from just consuming a protein supplement because everything gets broken down in your gut. But there seems to be, from the most recent research, that when you're intaking collagen peptides, that your body can more rapidly make that into collagen in your skin. Now, it's not direct. You don't eat it and it gets magically transported to your skin. That's been very well debunked because your stomach breaks all that down into just amino acids and little particles. But it does show that if you supplement with just a protein supplement versus with a collagen peptide supplement, wound healing and collagen synthesis is much higher in the collagen peptide supplement group. So I recommend my patients, same timeline, that you should at least do it that month leading up to it so that your body is kind of primed to what you're eating and that it has an excess of collagen building blocks, and then we'll stimulate it. And then your body will say, okay, we got all this excess. We're ready to make all this collagen, and it can throw all those resources. And it's just a little more efficient turnaround, I feel like. And then same thing afterwards. If you can stay on it long term, obviously we're always working on our skin in my practice, and anyone who's focused on well aging, you need to be mindful of how you're taking care of your skin. So if that fits in your budget, that would be something you could maintain long term. I don't have great recommendations for how much, but generally the numbers I come across from reputable sources is between 10 and 20 grams per day. Doing that for at least a month ahead and a month after any collagen stimulating procedures like Sculptra, just so that we have the best outcome, which is just another reason why I love Sculptra. We can do it on a lunch break and you can go back to work and not have anyone notice that anything happened. It's not something that truly makes you sun sensitive, but still avoiding the sun, protecting yourself from the sun is always the best practice, and not doing things like saunas or heavy exercise afterwards, as that can just draw a lot of circulation to the skin. And while we want circulation to help the product distribute, just having that flush and that hot sweating sort of environment makes you more prone to bruising and swelling at those injection sites. And that's something we don't want to encourage. So you plan on taking it easy for the couple days afterwards, but it's very undetectable as an in-office treatment. Aside from what does it cost, the most frequent questions I hear are how long does it last and when am I going to see results? Results truly come in stages because it's going to be this gradual onset. You're stimulating your body to do all this work for you. I say fine lines, probably about 2 months out, you'll see a modest improvement in them. Static lines, deeper wrinkles, we're more like 3 to 6 months to really see that. And for the deeper folds, we're going to count on those gradually improving over this time period, but I would count on 6 months plus before you really see that wow effect. And that also depends on how your prep work was, how well you're maintaining, and how many treatments you had in a row. The rule of thumb that's sort of out there in the ether is 1 vial per decade of life. And I like that as a very, very vague rule of thumb. So, if I have somebody in their 60s who comes in, we know we're going to have to do more treatments and use more vials than we would if there was somebody in their 30s who was just concerned with some smaller details. But that said, it should be tailored to you and your desires and your expectations and the areas that we're treating. No longer are we just treating kind of around the face for general improvement. We're focusing on nasolabial folds and temple hollows and cheek hollows and neck and décolleté and arms and hands. There's so many different areas that we're treating now. It really does need to be tailored, and you need to talk to your provider about what expectations are and recognize your own expectations for this. It is a wonderful treatment product, but it's not a miracle worker. It's not going to work overnight. These are not fast results. You see nice gradual improvement, and it's a very natural look, but you're going to have to invest in this, and then you're going to have to maintain it. While good sun protection and good skincare and good in-office treatments will help maintain this the best, your collagen is still going to break down, and we've done something to stimulate extra collagen in these areas. So planning on yearly maintenance or even twice a year maintenance, depending on your goal, that's perfectly normal. We're going to have to do something to kind of keep this up because the sun is always working to break down your collagen. Your genetics are working to age you and break down your collagen. So you do need these little nudges to keep up that same effect. But it doesn't dissolve like filler does. So there's no clear off point. There's no clear everyone needs a re-up at this point because it'll be gone. We know from studies that it still is mildly active even 12 to 24 months after those initial injections in some people, but it varies so widely. So discuss with a well-informed, properly certified provider to make those kinds of decisions, but do count on at least 2 vials and 2 sessions to see a notable result. I admit there was a time in my own practice when I was trying to be very conservative and conscious of budgets and tried to make 1 vial do magical things for the whole face. And all my patients and I would wind up with is just being dissatisfied with the results. It was not the proper dosage. It was not the proper treatment protocol. So if that's where you're at and you're thinking, well, I'll just get 1 and see if it does something for me, I think you would be better off to do like a laser or a microneedling or something like that versus 1 vial of Sculptra isn't going to go very far and you'll probably just be disappointed in the results. So again, another reason to have a good conversation with your provider about what you actually want to see out of it and what budget concerns are going to make that viable. While we generally treat kind of throughout the face, some of my favorite areas to treat are temple hollows in through here. This plane of skin, this plane on your face tends to lose volume really early in life. So that's why we see a lot of this inward and downward movement. A lot of my patients just say that that's when their face fell, that they feel like everything is just kind of tugging down and kind of jowly. Under eyes are having more problems, maybe some hollowness underneath the cheek, some irregularities. But this is just a really nice opportunity to really target the temple hollows because it'll give us some lift by both revolumizing this and also just encouraging that collagen to be stronger matrix, tighter matrix. So we get that little bit of lift effect. I can't tell you how many of my patients come in and we're doing a consult about any number of things, but this is what they do is if I could just like this, I think that takes care of my problem, whether it's nasolabial folds, sagging down here, under eyes, whatever. This is what we do. And the reason why is just this volume loss back here and the tugging that we see subsequently. So if we can come into this plane and really heavily target it with Sculptra, we're going to get that volumization to kind of give this less concavity, more of a smooth, flat appearance up here. That will help lift the cheek, the under eye looks improved, as well as this lower part of the face. Just all of that gets this nice little refresh. And since we're seeing that over the course of months instead of just overnight, it has this nice Benjamin Button effect of we're aging backwards because things just look better and better as the weeks go by versus, yes, we can do that with filler very easily, but that's not everyone's cup of tea. They don't want that instant reveal of their friends noticing that, oh, something looks very different. We just like that gradual, no one can quite put their finger on it. Everything just keeps looking better. They'll be asking you what makeup you have on, or are you trying a different hairstyle or new skincare? What's going on? And you can just, Sculptra can be your little secret, your ace in the hole. Thank you so much for joining me, friend, and thank you for requesting this video. I love Sculptra. I will happily answer any questions that you guys have down in the comments. Any other requests, please leave them down there as well. Until next time, be well.